Good day, my dear postgraduate students. We are all meeting after a long time. And the topic for the day is hemovigilance. It is a rather vague and weird topic, and let us see how best we can deal with this. Literally speaking, it can be called blood security. It is different from the hazards of blood transfusion, which can be divided into direct or deterministic, which means the blood transfusion is exactly the cause for this particular complication. Or two, it can be indirect, wherein there is a probability, but then it is not proven. We must remember that blood transfusion is not always necessary. It can be avoidable, and that should be borne in mind. So this comes under a group of disorders called as patient management systems. The introduction. You find that there is a high quality and safety standard that is being followed. And we have also mentioned the terms direct and indirect hazards. There is a lot of this medico-legal aspects of it which should be borne in mind. And there is evidence from this program called as blood management of the patient or patient blood management. The introduction. It is a very common procedure and it has been most frequently performed in the medical therapies in the world. However, it is not totally safe and free from risk. This particular word is a little important. Allogenic blood transfusion, that is from a similar person, is potentially associated with the greatest of hazards. Since I would like you people to kindly recollect this particular sentence throughout your class. Now, why has there been an evolution of the hemovigilance? It all came after the evolution of AIDS. There have been a lot of these personal and family tragedies, and bloodborne AIDS is not unknown to all of us. It created a perfect storm in the blood sector, healthcare systems, and the governments. In spite of all the dedicated service and the screening of the infectious diseases, this has come into vogue. And this is one thing that we will have to always remember, the patient blood management. I hope you are able to remember this individual. Karl Landsteiner, the father of blood transfusion. He himself was a biologist and a physician. And what he has said is there are a lot of things, but then nothing has been so very intriguing as the erythrocytes when it has been transfused from one individual to another. And also the A and B agglutinogens are dominant in the hereditary characters of blood according to the Mendelian laws. The allogenic route, when we talk about it, the blood chain, it can be given as a donation, as a fractionation, wherein a fraction of it is being given, preservation and storage that is being done and later on delivered, or for therapeutic and established treatments. So in all these things there can be a problem, and all this come under this patient blood management. So this is a chain that you people will have to remember. Trace the origin to the problem. It is a paradigm shift that since 2005, there has been the development of this patient blood management, though it has been known earlier in 1988, and some people say even in the 1800s. This is another person, William Hewson, considered to be the father of hematology. And this one particular paragraph alone, which I have highlighted from his quotes. An inquiry into the properties of blood, it is presumed, will be thought in a particular manner interesting, since there is no other part which has got a physiological reasoning that has been mentioned. So all this help in the development of the WHO policy on the patient blood management in 2021. These are certain things which you'll have to mention. And there are certain basic rights for the patients. That is, it can be the patient education, the empowerment, consent, and so on. So all these things will be encompassed in the term patient blood management and hemovigilance. So what are all the probable hazards? You people will have to know the requirement for the transfusion and decreasing the risk that is along with it, and what are all the advantages of the use of components. Yet another person, William Harvey, the father of physiology and circulation. Blood alone, he says, above all powers, is endowed with such notable virtues. Because there is no other material that is flowing throughout the body and causing a reaction which can save or take a life. This particular, there are a few flow diagrams which I had given. That alone I would like you people to memorize. For example, in diseases such as HIV or AIDS, safety and hemovigilance programs are extremely important. Screening, etc., you people know. The Western blot or the ELISA techniques. Political pressure and national reviews, such as funding, government policies, etc. And the consumer. Today we are talking about bloodless surgery. But when blood is being given, whether we can manage the complications and the efficacy of the transfusion guidelines in between the patient and the donor. So this particular flow diagram, I would like you people to kindly by heart. Hemovigilance. The thing is, I put it in a box over here. It is a quality control, the mode of implementation, the mode of risk management, and the methods to eliminate the risk. That is all given over here. These paragraphs I have taken as it is because two of these references are very commendable, and I have also mentioned them towards the end. Hope you people are able to identify this particular individual. In our first chapters, he used to come. Mechnikov, again, he was supposed to be the father of innate immunity, and he was the person who discovered phagocytosis and obtained the Nobel Prize. This is another diagram which I would like you people to kindly draw. Please by heart it. One, you people should be knowing about the hazards of blood transfusion and whether there is any method of improving it. So it has to be evidence-based. Secondly, the patient blood management, quality and safety programs that are being followed. Whether it is cost-effective, it saves money. This is all economics of it. And then basic ethics. Is it absolutely required? The patient and the donors are supposed to be experiencing some kind of a stewardship or brotherhood, and whether that is being followed in an allogenic donor blood. Who is who? I hope this is one of the authors over here, and this individual, I hope you are able to trace it. He is Denton Cooley. I think you would have heard of the Cooley's anemia or the Mediterranean anemia. So there is something like advance in the blood management. And this particular author has said, roads traveled. This is a wonderful reference. I would like you people to kindly go to this for this article. Transfusion. It need not be a default one, but then it has to be analyzed and whole blood need not be given, but components alone may be taken. And all the avoidable cases of risk shall and will be avoided. So, what are all the legal aspects? As I had been mentioning earlier, these must include the patient's rights, his ethics, the legal research based on it, the quality assurance, risk management, as well as the study on negligence. So these are important things. I would like you people to study what is in the box. Medico-legal aspects. There are a lot of things that have been given, but this word, it drew my attention. Primum non nocere, which means do no harm. Whether you save a life or not, do not harm a life. As a conclusion, we find that there are multiple things which are included in it, which can be the local health and the hospital authorities, as well as the high level government services whose policy matters we shall be following. That is why the word hemovigilance has come. When a question is asked, please do not blindly write something about the blood transfusion or the licensing of a blood bank and so on. But please use this basic term of PBM, patient blood management. This is yet another one, maybe one of the final things of the flow diagram. I would like you to kindly see this. I have put an asterisk over here purposely. Whenever there is a diagram, spend some time on it. I find that there is a broader end of the arrow over here and it tapers out towards the right side, which means there are more medical legal implications this side than here. So what will happen when the complications, they are fatal, major? You find that there can be medical legal implications, even if it is minor or insignificant. Ultimately, when there is a poor outcome. So it can be because of technical or clerical, donor or recipient related, individual or system error. See, so many things are encompassed in. This is a beautiful diagram. I think this alone will make you answer the question. The benefits, whether it had been life-saving, it improved the outcome as well as the quality of life. And also rule out any mode of error. As I told you, it can be predictable or unpredictable, preventable, non-preventable, minimized or accepted. So if it is something like this, we'll be at a lesser amount of risk. So these are some of the references. I would like you people to go to it. And finally, Sir William Osler. And this is a John Hopkins Hospital, which he was the founder of. And this is one of the articles written by him. And this I have again quoted as a reference. Thank you.